Pharmacy, because it is time for some great advice, and every month Sherry comes over and talks about something very relevant, and by golly, this is perfect timing and a lot of fun.
So give us the road report first.
Traffic's a little slow around Ankeny.
From Ames to Des Moines.
From Ames, yep, from Ames to Des Moines. So right around Ankeny, it slows down, but it's not bad. So just beware.
Okay, now your other specialty.
Now my other specialty.
People driving in somewhat of a fog, and there's some people that are in somewhat of a fog right now.
Yeah, it's a little drizzly, a little fog. Yeah, but in a fog, allergies. So it's spring finally, but the weather's kind of changed. And if we'll notice outside, the trees and stuff are just getting ready to start budding, and so a lot of people are going to start having allergy symptoms here pretty soon. So.
I feel like it happened overnight last week. Like we came in and everyone all of a sudden was just like, oh.
As soon as it rained,
it's like, okay, what blossomed?
Exactly.
The trees started freaking out, basically. When it rained.
Yeah, and that's kind of the deal. Is there's different seasons for allergies, and it kind of depends on what you're allergic to. And some people are lucky enough to be allergic to all of them and suffer all the time.
That's good for pharmacists.
It's good for pharmacists, right? But in the spring, it tends to be trees. So when the trees blossoms, and there's different kinds of trees. In the summer, it tends to be the grasses, and in the fall, it's the weeds. So the ragweeds and things like that. So. This one, it might be a little bit hard to read, but a lot of people, one of the most common questions we get is, how do I know if I have allergies or not? Typically, most people who have allergies know, but they usually have a runny nose, they're sneezing, itchy, watery eyes. That's kind of the main complaints that most people have. And they usually don't have a lot of other symptoms with it. So there's usually not a sore throat, although you can get that if you have a lot of drainage down the back of your throat. There's usually no fever or body aches. Sometimes some stuffy nose. Sometimes it can lead to asthma attacks if people have those. But that's kind of how we tell the difference. And it usually happens, like you said, kind of overnight. Like, you know, something's in the air and it starts, and now you.
I always wondered if I had allergies, and it wasn't until I lived in California that I realized I was allergic to something out there. But you know, when you get hit with allergies, it's just like you're hit with a wall. And
different years can be different based on when things bloom and pollen counts, and you know, it just can be different from year to year. Some people suffer more some years than others. Some people have never had allergies and then they do. So all those things can happen. And this kind of talks about the most common offenders that we have. So this is the different grasses. And then the last one is the weeds. Ragweed is probably the one that everyone is the most familiar with. So.
It says, and I don't know how, I don't claim to be an allergy expert or a pollen expert, but I always look at pollen.com, and right now in central Iowa, the pollen forecast is very high, and they're saying that the predominant ones are juniper, elm, and maple, which makes sense. The trees are waking up. We've had rain, so that's why, you know, and you felt it last week. I sure did.
Yeah, so when we start feeling these symptoms come on, what can we do to kind of ease the pain a little bit?
So one of the first most important things is obviously like avoiding or reducing exposure to the allergen. So like Jason said, meteorologists are a good source of information. They usually tell us when pollen counts are high.
I don't believe you
yet. So you gotta listen to
Mm-hmm.
Jason. But it's really important when pollen counts are high that you do things to reduce exposure. So turning your air on, leaving your windows and doors closed, making sure when you come in from being outside that you take a shower, especially before going to bed. Don't hang your laundry out on the line.
Sure, I didn't think about that. Yeah.
Sheets are great when they smell awesome, but not so great when they're covered with pollen on your bed. So.
Didn't think about that. Yeah.
So that's the first thing. You know, and then we have some medications that we can talk about.
A lot of them. A
lot of them. So these two here in the middle are kind of the ones that people are probably most familiar with for allergies.
The favorites?
They used to be the favorites.
Oh,
these are the oldies. They're the cheapies now. So these are Benadryl, which was this one, the diphenhydramine, the generic, and then on the bottom is chlortrimeton or chlorpheniramine. So these have been around for a long time. They work really well most of the time for allergy symptoms. The problem with them is that they require multiple doses a day, and they make people drowsy. So that's kind of the biggest problem with those. So what happened is what they call the second generation antihistamines came out, and that's these that are here. And so this is the generic Claritin.
Okay.
Here in the blue box. and then we have a generic Zyrtec and a generic Allegra. And the difference with those is they are just once a day dosing, so you take them once a day, and they really cause no sedation at all, maybe just a mild amount of sedation. The Zyrtec claims that they can have some slight sedation, so they recommend taking it at bedtime, but most people really don't have any problems with that.
Okay.
The key is whichever one you're going to take, it's if you can take it before exposure to the allergen, it usually works a lot better, and then you want to take it throughout the allergy season. So if
And you said to try, if one doesn't work, there's, you know, just keep trying. And
right, if one doesn't work, you can try a different one, and sometimes what works for you one year, maybe it doesn't work the next year. Sometimes you need to.
Now you mentioned some brand names here, and the difference between the brand name and what you have here is?
The box and the label, nothing.
And the price.
And the price, yeah. On
Okay.
the nothing on the active ingredient on the inside, unless you happen to have like some dye allergies or things like that.
Okay.
So.
And then you also brought some inhalants?
I brought, yeah, these are new. These used to be prescription only, and it's the Flonase and the Nasonex, and these are inhaled nasal steroids.
Okay.
And so sometimes when you have the allergy, your body is releasing histamine, which can cause a little bit of swelling in the nasal passages. And so these can help with that. And like I said, they used to be only prescription, and now they're both over the counter. So that's really nice. With these, they are usually one spray in each nostril once or twice a day. You do want to kind of blow your nose before you use it, and then not a lot of side effects with it, but if you're prone to nosebleeds, sometimes it can kind of dry out the nasal passages and make you more prone to those, so just kind of be aware of that.
Okay.
And this one I brought in as a test for you guys.
Uh-oh.
So it says Mucinex allergy on it. Do you guys know what's usually found in Mucinex? What is Mucinex typically?
Well, usually
It's an expectorant.
dries,
Right.
yeah, and dries out and gets rid of the mucus.
Right, it's
in your
usually an
nose and
expectorant that's used for cough or
lungs.
congestion, so it kind of thins and loosens mucus secretions. So you would, and guaifenesin is actually the active ingredient of that. You would expect it to have some guaifenesin in this. There's no guaifenesin in this. This is actually the same thing as this. It is
It's just
Allegra.
a Mucinex branded
It's
Allegra?
a Mucinex branded Allegra.
Really?
So I bring
Wow.
this in just to tell you that you really need to be careful and read the packages, and don't just look at the name. Like if it says Tylenol or Motrin, it may or may not have that ingredient in it, but it may have other things in it. So, but this actually active ingredient is just the fexofenadine, which is the Allegra. There is no Mucinex in there.
Let me see.
So,
No
if you have a cold and you're having allergies,
and
that's
here's what I
probably not
want
the
to
best
show you.
way
Can you zoom in on this, Craig? This is the important thing. Ready? This is the generic. Look at that, $17. Can you see that, 17? Same stuff, $29 because it says Mucinex on it.
Gotcha.
Right.
There's a perfect example of what we just mentioned.
Right.
So there,
Right.
so put
Same
that one in
chemical.
front of there.
Yeah, same chemical. So if you do have a cold, your question, you might want to have something that has some combination in it, so maybe a decongestant or a cough suppressant or things like that. So you might want to have something that's not just the antihistamine. And I know some pharmacists that could help
Do you really? Where would you find some of these pharmacists?
We have a few.
Do ya?
We have a few around the location,
there.
all over. We have some great pharmacists, and they would be happy to take time with you. And we go out into the over-the-counter sections. We don't just point to you and say it's over there. We go out, we ask you questions, we help you pick a product that will work for you.
Now, what if somebody wants to come see you?
I'm in Ames, so a couple days a week. So come see me
you go.
there.
Perfect.
Yeah,
Well, good to see you.
it's nice to be here.
Good job again.
Yeah,
As
thank you.
always. There's some great advice from Medicap Pharmacy. It's 8:32. We'll be back. You're watching Great Day Live in Des Moines.